Welcome everyone to the audio and video podcast of the Cleft Palate Craniofacial Journal. And I'm Pat Chibbaro, pediatric nurse practitioner here in New York, and really happy to highlight the paper of one of the authors in the special issue in February of this year, Spotlight on Early Career Researchers of the American Cleft Palate Craniofacial Association. And I'm really happy to have with me Dr. Catherine de Blackham, and from Ireland. And I wore my special sweatshirt, my special Dublin sweatshirt, because this paper is the effort of a really looks like a very dynamic group of people in Dublin. So let me tell you the name of the paper, and we're going to talk about it. It's something that certainly all of us are concerned about, the lives of our adolescents with clefts. And this is the name of the paper, Lives of Irish Adolescents Who Are Born with a Cleft. In addition to Dr. de Blackham, it's Bridget Gagan, Elizabeth Nixon, and Anne Nolan. And they are from Children's Health Ireland, from the Department of Pediatrics and the School of Psychology at Trinity College, from the Royal College of Surgeons, the Department of Social Research, Economic and Social Research Institute, as well as one of the authors is and I'll have you explain that, Catherine, PPI. So welcome. Just before we even start, how did you talk a little bit about this group? And I think papers that are, contributors from different specialties are just so valuable. Tell me about how that you all got together on this paper.
Yeah, it's interesting. And I suppose that's the motivation behind the paper really came from conversations with families, and that's where Bridget, who's the second author on the paper, and she's our public and patient advisor on the paper, and she is a graduate, I suppose, of our program at the Dublin Cleft Centre, and a really inspiring and articulate and very beautiful young woman. And it was through a conversation with her that my background is in patient-reported outcomes research, and we have an interest, and we recently introduced the cleft queue into our practice routinely and so on. And I was talking to her about that and reflecting on perhaps where we could go with patient-reported outcomes and how they're informing our care. And she said, Catherine, those questionnaires really make me feel othered. And I thought that was really interesting. So it's super important that we gather those targeted outcomes from our patients with regard to their cleft. But actually, by completing that questionnaire, it makes her feel different to the general population. And alongside that, I'd come across the work of, and we would all be aware of it in the press in Ireland, which is the Growing Up in Ireland study, which is the national longitudinal study of children and youth. And that study is designed to capture a sample of the population with a view to informing government policy around children and youth in the country. And there would be many longitudinal studies. I'm sure there's equivalent in the United States, but there's certainly many in the UK and across Europe. And so what we came up with this idea then to use the instruments that Growing Up in Ireland use in the general population and administer those to our adolescents within the cleft service, and then be able to create a picture, I suppose, of how young people growing up having been born with a cleft and how their life compares to their peers in the general population.
Interesting. So talk a little bit more about that. When when you were completing the cleft queue with her, she felt that she felt other. Talk a little bit more about that.
Yeah, and it's sort of a relatively new term to me, I have to say, to my shame perhaps, but I think it has sort of come into common use since maybe the 1990s, as this idea that one is being defined by a condition that they have or a difference that they have in comparison to what the perceived norm perhaps would be. And so she was really welcoming of the idea that rather than being examined as an individual who was born with a cleft, that her life would be investigated as an individual who's part of the general population of Ireland rather than someone who was born with a cleft, I guess.
Interesting.
What I'm taking from it. But Yeah, so I suppose that the message there is listen to the conversations with families and patients, isn't it? That's
Absolutely.
where the idea came from.
Yeah, I mean, just including the patients in our work, I think has become more and more important and valued, and and we're even seeing that a lot at our meeting of the American Cleft Palate Craniofacial Association, where we're having more input on all topics from those in either in the community. Um, those in the community who include those who are now healthcare professionals who have facial differences in the
Mhm.
community, and I think it just makes the work so much, it gives it so much more depth and richness to it. I'm really glad to see that you had done that. So tell us tell us about the study, sort of give us an overview. And certainly everybody who's listening, you need to, I think it's really important to read this paper, in our work with adolescents. So give us a little, overview.
Yeah, of the methods, I suppose. GUI have two cohorts of children. One group now who are in their 20s, but the group that I was working with are, I think it was about 8,500 or 9,000 babies that were born in Ireland in 2008. So they're cohort '08, and they would have turned 13 then in the 2021. And they were the target group. So they've been surveyed every couple of years by the GUI group as regards, and it's a wide range of information that they gather: demographic information, socioeconomic status, health, dental health, schooling, family dynamic, family situation, and yeah, a whole really broad range of surveys. So we were going to focus in the first instance on those 13-year-olds and use them as our comparison group. So we identified our children within the cleft service and who were in our database who were born between 2007, 2008 and 2009, so in and around that same time period, which is interesting in Ireland because that was the time that there was a big financial crash. So in terms of the wider impact, and that's sort of why that group were chosen for the GUI study, because they've grown up through a really interesting time. So that allowed us to look at, I suppose, the impact of social deprivation on development, and that's part of the wider GUI study. But I suppose maybe an aside to my group, but
Yeah,
that's
it's
why.
interesting because you said 2008, and I immediately thought of the financial crash. I mean, we had
Yeah,
it, certainly had it here. I thought of two things. One was 2008, and then the other thing was that the kids are 13. Did you say in 2021
yeah,
approximately? So right in the middle of COVID, which is a whole other story. It's
yeah.
wow, interesting
So that
group.
was, they're an interesting group for many reasons, but so what we did was we took the surveys that were, it would have been wave 6 of data collection for the GUI group. And we took their surveys as soon as they were released publicly. All of their information is published online. And we adapted them in conjunction with Bridget and some other PPI contributors who are the parents of children with clefts. To make them suitable and sort of strip out the stuff to avoid questionnaire fatigue that they didn't feel was relevant to our population. So we went through that process and then recruited the children. So we're limited, obviously, in the number that we have. We provide in Dublin just about a national service for cleft, so we would have captured as many as we can within our service, but that limited us. Full of 260 children at age 13. That was our big challenge, was recruitment was really low, and for probably a number of reasons, COVID, as you said, being one of them, and also that they're 13, and I think that's a really difficult age to
Yeah,
engage
yeah,
adolescents in research endeavors, and it's a really challenging moment in their cleft care. I think they're struggling at the, with no extraneous circumstances. You're struggling with appearance and with engaging with anyone, never
yeah,
mind a doctor or an orthodontist. Or
of
so
course.
we struggled with that, and we had a really low recruitment. We only got, I think, 11%, so we just had 30 participants, which was disappointing. But we managed to get a ton of information out of it, and I'm so
Yeah.
grateful to the families that did participate. And but yeah, so that was the methodology, I suppose, was to take these GUI questionnaires them and administer them to our to the young people that were in with service. And then really terrific medical statistician help and research assistants to chase people for surveys and to counsel them through the recruitment and the ethics and all of that stuff, which these days is just so complex and burdensome that so that was another challenge. But we managed to get them, and we did some of a select group of our patients.
Great. So I think what is, certainly interesting to me is when I saw the title, I guess I assumed that you would find that the lives of the kids with clefts were, certainly more difficult, that was, a big difference between those adolescents that were not affected with clefts, but it seems like that's not what you found.
Yeah, and what we found was what I was really hoping that we would find.
Yeah.
And that's because you meet families with an antenatal diagnosis of a cleft or new babies born with a cleft, and all I want to say to them is that, look, and what I do say to them is that this is a baby who's born with a facial difference that we can fix with an operation. We have a really good service that we will support them through childhood, through teenage years, and there's really no reason why they shouldn't live a full, happy, normal, healthy life. And I suppose I realize I'm saying this to people, but do I really, really know that? And do I have information to back up that statement? And together with what conversations that I had with Bridget and other patients, that was really the motivation behind it. And so I was really glad that when we got the results back in, that normal things in normal life, and parents want to know not just about teeth and face, but across their normal life.
Right.
Is my child going to be the same as their child sitting next to in class? And so we found that things like physical activity, like screen time, like social media, all of that stuff was the same between the two groups. So all of those things are similar. Their integration relationships with parents, family, children, bullying, for example, that was no different and that's something I think that parents will always bring up. So that was no different between our group and the wider population. So that was really nice to see. There were differences in self-esteem, I think, was a little bit lower in our group, and the self-reported dental health and medical care were a little bit lower in our group. And again, I think that's not surprising. And it definitely, I suppose the other motivation of this kind of study is to give me a little bit of ammunition when I'm trying to build my service and look for resources and where we should be targeting them. And I think that again, I'm really glad to say that we now do have a clinical psychologist with our team, but we didn't for a long time. And that's something we had to fight for a long time. So it's really nice now that I can see and I can say, well, we know that maybe our 13-year-old's self-esteem is something that we need to work on, but look, we have this lovely psychologist that you can talk to, and we now have the capacity to have a little bit of early intervention and know that period when they're heading into complex and a lot of a bit more strength to talk to our managers in the hospital and say, look, this is where we need the resource.
Yeah, well, I can tell you here on the other side of the pond that, it's the struggle for so many teams to be able to get funding for even a part-time psychologist, and I think, it's just, it's just so important that, if we're going to really be providing comprehensive care to these kids, we have to be able to, to provide that psychosocial support. So, and to the families, of course. So, and, I just think this is great for you to have this information, as you said, to let parents know, to give them hope that their kids will be kids, that they'll have the same difficult time at raising a teenager that every other parent has, and that's really important. And, it's like how important it was to me to network parents to those who had teenagers, to let, to give them that, to let them know what the future, really can be. And this study is another way of doing that, where you can tell parents, we actually did, we really we scientifically looked at this, we have data, I'm not just saying this, we
Yeah.
really feel that, that their life will, they'll have a good life, but we do need
Yeah.
to support them. So I'm wondering if, as you look, and you talked about the limitations, in terms of trying to recruit kids, and, we know why that was difficult, certainly. Um, Anything for the future? Or what are you looking, what are you looking at? Or are you looking to study other aspects of teenagers, or what other research are you looking at working on?
Yeah, well, it was a really positive experience to partner with the Growing Up in Ireland team. And there's huge potential, I think, for that kind of work. The GUI study has actually just opened another cohort. So they're recruiting babies who are 9 months in 2024. So that's going to be the cohort. So they'll have 98, 08, and now 24. And I think there's great potential for us to design a longitudinal study that would run alongside that group,
Great.
within our patients that are born with a cleft. So that's my next baby.
There you
That's the next
the
project
next
on the
baby.
horizon here in Dublin for me.
I love it. I love it. So, one
Exactly.
of the questions I love to ask the authors is, and it's interesting because this is a special issue on early career researchers. And since before we went online, I asked you about that, and I wonder, as and you are, I would not say you are a super early researcher, but so maybe explain to the listeners sort of what your journey was to where you are.
Yeah, I know. And I read that call that wonderful Jamie Perry wrote for the
The
journal. And
wonderful Jamie Perry. Shout out to Jamie. We love
yeah,
you.
I said, I was reading it and I said, gosh, this is, this would be a nice forum for the Leah Cleft study. And I said, but surely I'm not an early career researcher. But then I was reading, said, if you're only X number of years in practice. So technically I'm only 3 or 4 years in practice as
You're
a cleft
still a
surgeon. But
baby.
I suppose my research career started a long time previously, given that just the arduous journey of surgical training when I went through was that we had to take a number of years out to do research full time. So the time I spent, I suppose, in research predates my time in either surgical training or certainly cleft training or an appointment as a cleft surgeon. So
What do you think
yeah.
about that process of the way that training is it the same way now? Is the process the same?
There's been a big effort to streamline it a little bit more. So I think
Mhm.
people are coming through a lot more efficiently now, which
Yeah.
overall I think is better. And I think that certainly a research career is not for everybody. And I don't regret any of the time that I spent. It's all been hugely fulfilling, and I've really enjoyed every step of my journey to where I am. But I do, yeah, I definitely have the impression or the feeling that because I spent that time in full-time research, that I try to carry it on in clinical practice. But I'm sure every person listening will recognize the challenges that presents.
Yeah.
So it's something that
Balancing.
I really
Yeah.
struggle with.
Yeah, balancing the practice and, the research. I mean, it's impressive to be able, to do that. And certainly, doing it as a team is just, I think, a really great way to get a lot of good work out, from with different perspectives. So and that's one of the things that I always like to see it, in your paper, where you have, it's not just a paper written by a surgeon, it's got the input of others, and it really, I think, really gives it a lot of depth. And I wonder, regarding research, what, and a lot of early researchers, I'm sure, are reading all the papers in this issue. What thoughts, advice you might have for someone that's really just maybe starting that, that year of research, or just starting to think about, well, I might want to study this.
Yeah, gosh, I mean, what have I picked up along the way? I mean, it's really important. Good guidance is really, really important. I had a wonderful mentor in the year I spent doing research in Boston. And I remember he would say, it's really important to read papers and pick out people that write important work and papers, and be cautious of what you hear maybe at conferences. And because we were coming back from a conference and sitting in the airport, and we were talking about who we'd heard speak and so on. And he said, well, you know what, just check on PubMed and just see what people are publishing really meaningfully. And I would always say that to my trainees, and follow the people that you like to read, find and attach yourself to them, and people respond to that, I think. And that certainly always served me well. And making friends is really important. And the papers that I've written and the most fulfilling endeavors that I've been part of are from conversations at conferences and meeting friends and making those international connections has been really stimulating and a huge privilege and pleasure as part of my career. And I think, finding questions that inform your conversations with parents and patients. And I think it's lovely to be able to say, well, we've examined 100 of these cases, and I can tell you that the complications that we had were this, or what we found was that, or I can tell you now for sure that I know that your child will spend just as much time on social media as the child next to them in class. Or
Exactly.
so pick good questions, make good friends, and funding is really important. And I would love to say that I had a funded chunk of research time. I don't, but so that's something that is important from the outset. And I think one bit of funding leads on to more, doesn't it? So if you
Yeah.
can establish as early as you can in your career, I think that's probably important. But that's the real challenge, and it's a real challenge, I know, in the United States at present
I was
too.
just
So
going to say it's really a challenge right now, and hopefully, things will, it won't be this way forever. But yeah, we are challenged, but we have to keep pushing through. And it's interesting. Your first response was finding a good mentor, and that is absolutely always the first thing that every author has said to me.
really,
It's always the first thing is you need to get guidance, you need a good mentor, and I'm just and it's true, and that's one of the things that I think is so great about our organization, is that ability to access not just mentors who you work with in your practice, but just mentors around the world, and I think that's a really important thing. And that's why I used to encourage my young residents, try to request to get to this meeting. So that will be another way of you getting getting access to those, as you say, that the people that are really doing the work. So great
well,
advice.
it's a small world that we're in, isn't it, in cleft particularly. So it's amazing once you start going to meetings that we're a small group.
Absolutely, absolutely. So let me it was so great, sharing this paper with everyone. And let me just again let everyone know this paper, which you can find easily online in the Cleft Palate Craniofacial Journal. It's the special issue, Spotlight on Early Career Researchers of the ACPA, and it's Lives of Irish Adolescents Who Were Born with a Cleft. It's pages 188 to 200, and the authors Catherine de Blackham, Bridget Gagan, Elizabeth Nixon, and Anne Nolan from various parts of Dublin, and specifically Dr. de Blackham is at the Children's Health Ireland, and I think it's just, as I said, so important to see papers like this, to look at the psychosocial issues and also to look at them as a team, from a group of specialists. So I think you've done a really nice job. And even though you had a small sample, I think it really tells the story. And it's really, it was heartening to me that, that the kids, we're very similar. And I think for parents to hear that, gives them that hope that we talked about. So Catherine, thank you so much for joining me, and everyone who's listening, take a look at this paper. It's really nice to read it. It's really lovely. So thank you very much.
Thanks for having me, Pat. It's my pleasure.